Want to see a doctor? Well, you might have to wait for months.
Hawaii's doctor shortage is growing worse, according to both physicians and patients.
KITV4's Kristen Concilio now joins us live to explain why. Kristen.
Well, Rick, Mika, healthcare worker shortages are nothing new, but the situation's been made worse by the pandemic, the rising cost of living, and sheer demands of the job. And now more and more patients are suffering the consequences. Mary Lou DePonticello has learned how to give herself treatments for lymphedema, a side effect of breast cancer. A necessary routine because she can't always see a doctor.
So I have learned strategies myself of what to do. And my specialists, thank goodness, who have left, taught me the lymphedema massages to give myself. And I've had to ask my own husband to help me.
Diagnosed with breast cancer 9 years ago, she's had a difficult time getting care right away.
I found out that I had cancer, and then I had to wait weeks to go get what is called a PET scan and to find out if it had spread. So those 4 weeks, I will say, were the scariest of my life.
She, along with many others, say the delays are even worse today. Wait times across the state can be more than 6 months, according to the Hawaii State Rural Health Association.
And even for cancer patients, which is unheard of because that can mean the difference between life and death. It's frightening to look at the shortages that we're experiencing across the board.
The Hawaii Pacific Basin Area Health Education Center puts the shortage of doctors at more than 700, and the future outlook is grim.
I hear, every week also of patients that their physician's practice closed, or, something happened to them, or they, sold their practice or whatever. So we are in for a little bit of, a bumpy ride.
DePonticello wishes the ride were smoother.
I'm always anxious. It's just something of being a cancer survivor.
Now, the Hawaii State Rural Health Association is currently surveying residents and providers about access to care issues. And those in the medical field are working on ways to recruit and retain providers and get more children interested in science and medicine to prevent a healthcare crisis. Kristen Concilio, KITV4 Island News.